Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Well, things seem to be moving in the right direction. Maybe you can talk about that and the idea of talk of a fourth booster for the fall for some people.
Yeah, so things definitely going in the right direction. Just a little over a month ago, we had over twice as many hospitalizations as we have today, which is about 80,000. And as far as new cases are concerned, they've dropped from over 800,000 to 100,000. So definitely the right direction. Where we are now is still bad, but it's going in the right direction.
I'm sorry, didn't mean to interrupt you.
No, no, about the fourth booster, not approved. There are 3 countries in the world that do approve that, have approved it. Israel for people over 60 and people with underlying diseases, and in Sweden, people 80 and over. The other country is South Korea, so it's not approved yet.
Let's talk about a story in the New York Times that the CDC not publishing large portions of COVID data. What are they not publishing and why would that be?
That's a really good question, Robin. The CDC has mountains of data. They get reports every day from the states. And what they have not been reporting on are the data on hospitalizations, breakthrough infections, the booster effect, particularly in people 18 to 49, and wastewater surveillance, measuring the virus in the sewer systems to see if a city has a lot of infection going on. And basically their excuse is the data are not ready for prime time. The data may be misinterpreted, meaning that a lot of the data they have shows that in like that younger age group, boosters don't help or something like that. We don't even know what it is. And what that does is for people like myself, we're getting most of our data from the New York Times and Reuters and AP and other press agencies, WGN, you guys report to. That's and the other thing, we're making decisions based on what's going on in Israel because they report their stuff real time. It just gets out there. If it doesn't make any sense, so what? They just keep pushing the data out the door. And I don't understand why CDC hasn't done the same thing. Data or data, we could argue about the data, whatever, but there's no reason for this, and they just blame their bureaucracy and whatever. It's just a knee-jerk reaction.
All right, let's get to some viewer questions. What's your advice for parents of children under 5? How can we protect our kids from the new stealth Omicron variant?
Well, under 5, the Pfizer vaccine thing didn't work in kids under 5. They're back to the drawing boards on that. Basically, all you can do for kids under 5 is just keep them masked and be careful with them. This whole mask thing in kids under 5, they get mild disease. Kids still end up in the hospital. And we also don't know about long COVID. So until the whole epidemic has really calmed down, they should continue with the masking, in my opinion.
All right, next question. I received my booster shot about 6 months ago with the Omicron vaccine supposedly coming out in March. Would you recommend getting the 4th shot or wait for the Omicron vaccine?
Well, it's not approved yet. You can't really technically get it, although people, can sneak and get it or go to Wisconsin or whatever. But it really depends on your age, your underlying condition, or the risks that you have, whether you're going to get it. Like I mentioned before, how in Israel it's only for older people and people at really high risk. Sweden, it's 80 years and older. And so there's no vaccine to wait for at this particular point. And it's the current vaccine. The Omicron vaccine is being developed. But that's many months away.
All right, here's another question. I work at a store. I am vaccinated and boosted. Do you recommend I continue to wear my mask after the mask mandate is lifted?
Well, again, it depends on the age and risk factors of the person. I would say for the first month when these mandates are lifted, that if you're working with the public and people aren't wearing a mask and you don't know if they're vaccinated or not, which is typically the case, that you should continue to wear a mask, at least until we figure out that this thing is really going down and we're not going to have another wave of infection with this BA2, the stealth variant. So I would be a little cautious, especially in the first month or so after the restrictions are lifted.
All right, if you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or go to our Morning News Facebook page and post them there. We'll talk to Dr. Murphy again on Friday. Have a good day.
Have a great day.
Thanks, Doctor.